Welcome to the Trinity Health IHA Medical Group Wednesday Wellness Series. This presentation is titled Emotional Preparation for Labor and Building Birth Preferences. Our presenting providers are Trinity Health IHA Medical Group Obstetrician and Gynecologist Lauren Wichelmann and Certified Nurse Midwife Nicole Sekulich. They see patients at the Medical Center on Schoolcraft campus in Livonia. Welcome.
Thank you. Thank you guys so much for having us on this talk. We're really excited to chat with you today. If you guys are interested in hearing a little bit about our background, Nicole, go ahead and go first.
My name is Nicole Sekulich. I'm a certified nurse midwife here at the Trinity Health IHA Schoolcraft office and catching babies at Trinity Livonia, formerly St. Mary's. I've been a midwife now for about 8 years, and prior to that, I have labor and delivery experience from St. Joe's, Ann Arbor. I also practiced there for 6.5 years, still pick up contingent there every once in a while. I love my job. I'm passionate about what I do. I love taking care of women and babies, and I'm excited to talk with you guys tonight.
Thanks, Nicole. Hi, everybody. I'm Lauren Wichelmann. I am originally from Chicago, Illinois. I did my undergraduate training at a small school called Nova Southeastern University in Florida. I came back to the University of Michigan for my master's in physiology and then completed medical school at Nova Southeastern again, down in Florida. I did my residency training at a program in Chicago called St. Alexius Medical Center. And I recently moved here over the summer to start my practice here at Trinity Health in Livonia, and I love my partners and my colleagues very much. And I also have a very strong passion for women's health. And although I do see both obstetrics and gynecology patients, my true passion resides on labor and delivery. So I'm very happy to be giving this talk with Nicole today on how we can better prepare you for this journey.
Here we have both the offices. Dr. Wichelmann and I see patients at the IHA Schoolcraft campus, and then there's also a picture of Trinity Health Livonia. I just figured I would share that with everyone. The outline of our topics today is emotional preparation for labor, and really everything underneath that is going to be supporting that. So knowing yourself, nutrition, environmental risks, exercise in pregnancy, sleep in pregnancy, emotional support and toolkit, developing your birth intentions, and your journey home.
We are going to turn off our video just so you guys can focus on our slides. And you guys can see the full picture of our slides that we're presenting for you guys.
So emotional preparation for labor. Emotional prep for labor is like preparation for anything in life. We get ready to go to school. We plan and prepare if we're participating in a sporting event. We plan and prepare for our daily work or going to work. And we typically plan and prepare for most events in our lives. Labor and birth preparation is and should be no different. Often when preparing for labor, because of the natural unpredictability, women and families have fears, and by emotionally preparing for your labor and delivery, you can enter this event with confidence and decrease in fearing the unknown. So where do you start? After you have the positive pregnancy test. You might not realize this, but in the United States, close to 50% of all pregnancies may be mistimed or unplanned. But that's not to worry. It's never too late to begin healthy habits that will help you with your emotional preparation for labor. When you find out you're pregnant, it is essential to contact your healthcare provider. Our office staff are prepared to guide you to begin your course of care. Once you begin your care, we will be completing a medical and surgical history, completing a physical exam, and reviewing recommendations for your pregnancy that will include certain laboratory testing and screening and ultrasounds. As providers, we talk with women about activities and lifestyle modifications that are meant to set you up for success throughout life and throughout pregnancy. Prenatal visits are, for most patients, set on a standard schedule. Typically, you will have time visits with your prenatal provider that occur at different week spacing. So for instance, in the first to second trimester, your visits should be about every 4 weeks. And then beginning in third trimester, the visits become more frequent. At each visit is an opportunity to check in with your provider and ask questions. Please keep in mind, we want you to feel comfortable to talk about anything that might be on your mind. Let's go over some basics that can help set the stage to feeling empowered and emotionally prepared for your labor and birth. So what do you know about yourself? When emotionally preparing for your labor and birth, consider some things about yourself. What makes you tick? Do you do better with planning, under pressure, or when options are presented to you? How do you respond when faced with new challenges? What are things that you like to do or know about yourself to emotionally keep you balanced? How do you relieve stress? What brings you a sense of peace in stressful times? You might bring these things up at your visits. You might be surprised to learn that some things you may not think to be an asset in preparing for labor and birth may actually benefit you. Some of you might know this guy. This is Po from Kung Fu Panda, and he is in a constant search for inner peace. And I like the quote from Kung Fu Panda. It comes from his master Shifu, pointing out to Po that before the battle of the fist comes the battle of the mind. People will question over and over throughout pregnancy, am I going to be able to do this? And yes, we can help guide you to believing that you can. After Po, I thought it was important to go to nutrition, because if any of you know Po, he loves his wontons. So one thing that people do worry about is what we're putting in our bodies when we're expecting. This is a valid concern, and we want to take appropriate amounts of food to sustain a healthy pregnancy and avoid complications. We suggest to avoid added sugars, refined grains, alcoholic beverages, any supplements with CBD in any quantity. We would like you to take a prenatal vitamin daily, as long as you're able to tolerate it, and check to make sure that your prenatal includes at least 400 micrograms of folic acid. Other micronutrients that are important in pregnancy are vitamin D, which typically your prenatal has about 600 international units in it. Calcium, we would like you to get about 1,300 milligrams of that daily. That's actually not included in your prenatal vitamin. And DHA. One vitamin to avoid in excess is vitamin A. To balance your nutrition, you'll want to try to take in about 71 grams of protein daily in the second and third trimester. Healthy protein sources include lean meats, poultry, eggs, seafood, beans, peas, lentils, nuts, seeds, and soy products. Highly processed meats are not recommended. Please contact your provider if you're craving any non-food items, such as laundry soap, baking soda, clay, in any trimester. Continue to see your dentist for regular cleanings and checkups. Weight gain recommendations in pregnancy are often going to be individualized and discussed at different times throughout your pregnancy. Too little or excessive weight gain can contribute to complications for both the pregnant patient and the baby. I always like to tell patients to eat the rainbow, include nutrients from many different sources. Looking at environmental health, there are some toxical chemicals that we want you to try to avoid in pregnancy. In particular, plastics with bisphenol A, fertilizers. And one good thing to keep some of these things out of your house is removing your shoes at your entrance to avoid tracking the chemicals in. Lead paint, asbestos, mercury. Mercury can often be found in fish. Some fish that should be avoided for known high levels of mercury are mackerel, marlin, orange roughy, swordfish, tilefish from the Gulf of Mexico, and big eye tuna. You can also find a list from the FDA.
One thing to add about that too, to just keep in the back of your mind, is that these fish that are found to have higher mercury levels are typically fish that eat other fish. So smaller fish are less likely to have mercury than some of the larger fish that eat other fish, which kind of just makes sense. So you can kind of think about it that way when you're thinking about which fish are safe to eat in your pregnancy.
The FDA.com website actually has great insight and information too, especially living in Michigan and fishing season is starting and people do like to go out and fish, and you can often even narrow it down to which rivers and lakes are better to get fish that have less mercury in them. Another resource is a phone number, and the group is called Mother to Baby. And this phone number included here, you can call at any time if you're ever concerned about an exposure, and they're going to be able to help determine if it actually is something to be concerned about.
As far as exercise in pregnancy, we know that there are several benefits of exercise when you're not pregnant, such as a lower risk of overall mortality, a lower risk of cardiovascular disease like high blood pressure, and lower risk of type 2 diabetes, abnormal lipid profile, cancers of a lot of different organs, including the bladder, the breast, colon, the lining of the uterus, esophagus, kidney, lung, and stomach. And there's additional benefits to improved cognition with a reduced risk of dementia, improved quality of life, reduced anxiety, reduced risk of depression, and improved sleep with a lowered or reduced weight gain, an obvious weight loss benefit, and improved bone health. In women who have an uncomplicated pregnancy, we recommend consulting with your OB care provider regarding the benefits of exercise as your pregnancy continues. For pregnant women specifically, we recommend reduced risk of excessive weight gain that could lead to gestational diabetes and postpartum depression, depression during pregnancy, decrease in stress, anxiety, and improved sleep. Those are some of the benefits of continued exercise when you're pregnant. However, women ask what activities they should avoid. Specifically, things that we would recommend you avoiding while you're pregnant are sports where you could injure yourself or direct impact to your stomach. So things like ice hockey, boxing, soccer, and basketball. If you have a high risk of falling with any of the activities, we would also recommend you avoiding those types of things like downhill snow skiing, water skiing, surfing, off-road cycling, gymnastics, and horseback riding. And then as far as very specific exercise activities, things like scuba diving and skydiving are some of the things that we would definitely want you to avoid as well, due to the high risk of an injury, or specifically with scuba diving, some of the oxygen changes that happen when you go deep underwater are not safe for pregnancy. As far as exercises that are safe, or they're great to continue if you've already been doing these exercises, are things like walking or swimming, stationary cycling, low impact aerobics, yoga or modified Pilates, which would include anything except really inversion exercises where you're kind of balancing on your head or things like that, which would increase your risk of falls. But we'd also recommend things like modified running or jogging, strength training, and even pelvic floor muscle training like Kegel exercises. The most important thing when it comes to exercise in pregnancy is listening to your body. This is the best way to easily determine if your workout is too much, by essentially doing the talk test, which if you are able to carry on a normal conversation with moderate exercise intensity, then that's kind of the upper limit of what we would consider normal level of exercise. However, if you are doing vigorous exercise where you're noticing a substantial increase in your work of breathing, or you're unable to carry on a normal conversation with the person next to you, that's probably the limit where you're pushing it too hard and you should maybe back off. Give yourself some rest. So after a nice nutritious meal and a workout, next thing on our list to talk about is sleep in pregnancy. The National Sleep Foundation recommends getting between 7 and 9 hours of sleep every night. Often women will report difficulty sleeping in early pregnancy and again later in pregnancy, due to a multitude of different factors, as some people experience in the third trimester. Sometimes you get insomnia, which is, women will wake up at 3 in the morning and they say, gosh, I couldn't fall back asleep until 5 a.m. And then next thing I knew, my alarm went off and it's time to start my day again. But often women will ask how they can improve their sleep and some tips to try to develop. Basically, we want to give you some tips to try and develop a routine to avoid the complications of poor sleep in pregnancy. So try a warm bath or shower before bed. Try to avoid caffeine or other beverages close to bedtime or after dinner. Set your home thermostat to a nice, comfortable, cool temperature. Avoid screen time prior to bed. You can read in bed until you feel sleepy, and also try relaxed breathing or visualization techniques. It's helpful to surround yourself with pillows, and it's okay to get creative with your body positioning for comfortable rest. Some other tools for comfortable sleep can include a beanbag or some inner tubes that are easily purchasable. I guess you can purchase them on Amazon too. As far as safe positions for sleep, when you get to that 20-week mark in pregnancy, we recommend that you avoid sleeping on your back. So after 20 weeks of pregnancy, we want you to either sleep on your side or potentially with your head kind of elevated, just so that you're not completely flat on the bed. And this is because as your uterus grows in the pregnancy, it can put a lot of extra strain on some of the anatomic structures that are behind your uterus when you're laying flat on your back.
You can see there in the middle, there's kind of a deep side lying position that some women don't realize they can actually go that deep onto their side, and it takes some of that pressure off of the hips. And this is also the position if you were going to use one of those 20-inch inner tube, which I'll tell you right now is the perfect time to buy those in Michigan as it gets into our summer. They have them everywhere. You can just blow them up, throw a soft pillow or blanket over, and kind of tuck it under your belly, and you can get into this nice deep middle picture stretch there.
And then one topic I wanted to touch on too with the picture of the bathtub that we had there. Especially so it's great to take a warm bath just for comfort, but in the first trimester, we actually want you to avoid taking like a really piping hot bath where you'd be soaking your uterus and potentially the very early pregnancy under the hot water, just to avoid any complications with that very early gestation. But bathtubs are a great way to relax otherwise. So regarding mental health in pregnancy, we take this just as serious as any of the physical complaints that you might find troublesome in pregnancy. So we want this to be a safe place for you to reach out to any of your mental health care providers or any of your OB providers for that matter too, if you're having any difficulty with mental health during pregnancy. It's always okay to ask for help. PMADS is an acronym that stands for perinatal mood and anxiety disorders. This is usually temporary and can be treated with a combination of both self-care, a social support network, talk therapy, and even sometimes medications that have been deemed safe in pregnancy. For more information, you can visit one of these websites or call the helpline. And we also wanted to include the Suicide and Crisis Lifeline, which is just 988. You can dial it from any phone, even your cell phone, and they're available 24/7 in both English and Spanish. This can be a really great lifeline if you just don't know where else to go or don't know what to do. But it's important to know that when you're pregnant, your feelings and your mood can change very quickly. So these up and down shifts in your mood are usually caused by both physical and hormonal shifts in your body during pregnancy. And essentially, this can last throughout your pregnancy and even up to 1 year after your baby's born. About 1 in 5 pregnant women experience these PMAD symptoms. And some people know that they have a history of depression or anxiety, while others may develop this in the pregnancy related to a multitude of different stressors, like becoming a parent, for instance, and the personal, social, and environmental changes that go with being a parent and going through pregnancy.
Throughout your prenatal care, you will often hear your prenatal provider letting you know that if you have any concerns related to the health of you or your baby, we would like you to contact your OB or midwife office. IHA is set up with a call center after hours to help answer questions related to medical concerns in pregnancy. You may be directed to come into the emergency department or the labor and delivery unit based on these concerns. There are also times in the pregnancy when something may come up that is not related to the pregnancy. We can help guide you in your next steps in that care. You will also receive information after each visit of possible precautions to watch for in pregnancy and events that may require immediate attention. So emotional support. It's really important for you to think about What is your toolkit of emotional support going to be? With every positive pregnancy test, there is the opportunity to fill your emotional toolkit with people that can support you in the ways that you can be supported. Communication is key. If you're feeling stress related to your upcoming labor and birth or your birth, talk with a group of people that you trust. One person in this toolkit that you may have never heard of is the doula. We have included partner, provider, family, friends, spiritual leaders, and then doula. Doula support. Doulas are non-clinical caregivers who provide physical, emotional, and informational support to pregnant people and their partners before, during, and after childbirth. Doulas might provide information about the procedures performed and actions taken during and after labor and the postpartum period. Doulas can help explain your birth plan or intentions and advocate for your emotional and physical needs to hospital staff. Doulas can offer physical comfort through activities like massage and focused breathing. Doulas can guide and support your family and loved ones, and they can also help with breastfeeding. When searching for a doula, your OB provider may have some specific suggestions. Meet with your doula to see if the support they're able to offer is the support that you may be seeking. Some insurances will cover doula care, and you may be able to utilize FSA or HSA to help cover the cost of doula support. Some families find it helpful to have a doula prior to birth, and there are times when families may find it most beneficial to utilize doula support in the postpartum time period. Taking childbirth education classes can help you to prepare for your labor and birth or birth. Classes are led by a trained instructor, typically include lectures, discussions, and more information. You will want to choose a labor support partner to be there for you during your labor and birth. You and your support partner can take courses together to help your labor experience go as smoothly as possible. Some different resources for childbirth education. I always like to point out, go to the library, open a book. Sometimes that's going to be your first thing. Look up community doulas. You can get information even from the websites, and then that might be some of how you decide on if you do want a doula. Childbirth ed is offered through Trinity. We do have a website here. It's the stjoes.org, health and wellness classes and events. And depending on your place of birth, you can pick different options related to those different places.
So we didn't want to bore you guys with any data or, any crazy studies, but we did want to share that there is some pretty good literature out there for patient expectations when it comes to labor and delivery and their entire birth experience. The Green Journal is a special publication resource that's available to OBGYN providers where they produce literature from really great sources that help us guide care for our patients. So we wanted to include this study that was in the Green Journal from May of 2020. The title of the excerpt was Communication, Respect, and Autonomy, Exploring Elements of a Meaningful Birth Partnership. Their study was a survey that looked at 155 patients that were consented and enrolled, with a mean age of the patients in this group of 27 years old. What this study found was actually that medical terminology by their OB healthcare providers that was overly, just medical jargon, words that the patients couldn't understand, that negatively impacted the patient perceived respect by their provider. This study also found that patients were more satisfied with the time spent with their maternity care providers, and they were also more satisfied when they were encouraged to participate in the care. These both had positive impacts on the patient's autonomy, or in other words, the special word that means the patient's active role in their care. They also found that using certain websites and apps with pregnancy and childbirth information were considered twice as more valuable as childbirth education classes that were, considered your traditional Lamaze classes or things like that, which I thought is great because of the widespread availability of all the free apps and websites that we have available to us now. There's some other evidence that also suggests factors that have a positive effect on patient satisfaction during labor. These include things like the patients feeling their provider explained their intrapartum course well, meaning things that happened during their labor and delivery process. Patients liked when their providers went into detail and kind of explained more about what was going on. Patients also enjoyed having a say in managing their labor, being offered options by their provider, and having an increased level of support during their labor. All of these things were shown to have a positive correlation in the patient's experience with their labor and delivery process. What they also found was that complications during labor were actually not significant predictors of the patient satisfaction, but rather understanding the labor and delivery process as a whole were associated with higher patient satisfaction. So in short, regardless of what was actually happening during labor, patients were actually more satisfied when their labor events were explained in a way that they could understand, and when they were also included in their, the active management of their care.
That makes so much sense.
It does. So with our new era of Instagram and TikTok and influencers all over, there's a lot of access to information out there. Some of the information is accurate and some of it is not so accurate. We live in a very fast-paced, timeline here of information availability, and that's just our culture that we live in now with increased access to the internet. But when you're seeking information, it's natural to go to the easiest source available, which is sometimes the internet, and sometimes it's your healthcare provider, and sometimes it's a family or friend that might have gone through labor before you. Although it's tempting to believe everything that you see on the internet, please keep in mind that not everything you see, read, or hear from the internet is true. Also keep in mind that with Trinity Health, we practice evidence-based care, and we understand that labor and birth is not a one-size-fits-all, so it's important to remain flexible in care of individualized care for our patients. 2 labors and 2 births will never be the same, even for the same patient. We like to individualize care for you and your baby throughout your pregnancy with the goal of a safe, respectful environment for you and your growing family. Throughout your prenatal care, one of our goals is building a trusting relationship where you feel safe to ask questions and receive the care that we can provide to you and your growing baby. One thing that we encourage you to do is to know where you're going. Take a tour before your due date. Practice the drive from your house to the hospital. You're welcome to tour our birth center at any time as long as you call ahead. Sometimes there's certain times of the day that work best so that someone's available to take you around and show you around the unit. Your provider will be able to provide you with up-to-date information on those timing and the dates of the tour. So definitely ask us about that at your next OB appointment.
And then just have your support members lock in the address to your OB office and your intended place of birth. That way it won't be so much up to you to realize how to get there. So what's in a birth? A birth plan, a birth intention, a birth goal. The thought of labor would be likely easier if all we had to do was wait for that stork to drop off our special delivery. The truth is that we know the process of labor, AKA work, evokes so many emotions. We hope to ease your minds in preparing for your delivery. Often pregnant patients come to prenatal appointments with questions about labor and birth and what to expect. You are not alone. Some of the most frequent questions are, what will it look like? What will it sound like? What will it feel like? How am I going to know when I think I'm in labor? And although there are some things that seem obvious for signs of labor, sometimes events or actions don't always equal labor. One way to help in working through your labor or your birth can be to develop birth intentions, a birth goal, or a birth plan. Having your birth plan, goal, or intentions can be a useful tool in emotionally preparing for your birth. A written birth plan helps us as providers and those at the birth facility understand your preferences for labor and birth. Keep in mind that a birth intention, plan, or goal should be flexible enough to keep you and your baby safe if unanticipated events occur during your labor or birth. In talking with your provider, you can review specific wishes and also discuss possible policies or practices specific to your place of delivery. I added in the QR code that connects you with a sample birth intention worksheet. It's helpful to bring a sample to your visits and to make a few copies to place in your laboring room at the hospital you have chosen to deliver at. Sometimes it's helpful to review your birth intentions over a few of your prenatal visits. One great thing that I think is to add into birth intentions, and I think sometimes patients forget about, are maybe cultural preferences. And one example of that I can say is I had a patient once where the family asked, once the baby delivers, can it be silent in the room? And the baby needs to hear its father's voice first, like a whispering. And I just thought that was so beautiful. And that was something that was included in the birth intentions, and everyone was able to see right away and kind of follow.
And birth intentions don't necessarily have to involve anything medical. It can just be, we'd like to have this type of music playing. We'd like to decorate the room. We'd like to have pictures up. And these are all things that can make your experience a little bit more personalized and help you create the most welcoming and peaceful environment, like we mentioned at the beginning of this talk, that, this is your experience, and we want to help your intentions come to life in that special moment for, those hours or days that you're in labor. And any way that we can help support you with that, it's helpful if we can arrange anything for you ahead of time in order to make your stay more comfortable.
For birth intentions and birth plans, we want you to consider your passenger. Throughout your pregnancy, that's the time really to also research a pediatrician if you haven't already chosen one. Your OB provider may have suggestions for you, and you can also research on IHAcares.com. Many of us in the office have QR codes to the different IHA OB care providers that can care for babies. And they also do some meet and greets with patients, which is really helpful. When you're at the hospital, you will not need very much for your baby. Maybe a sleeper, an outfit, something to travel home in, but diapers and wipes and t-shirts and blankets, all of those will be provided. When trying to figure out a car seat, keep in mind that Trinity hospitals do not do safety car seat checks. These can be done at the local fire department of the community that you live in. You'll need to call your local fire department to see if you need to make an appointment for this. Also something important to think about is your desired method of feeding for your baby. Since 2012, the American Academy of Pediatrics has recommended exclusive breastfeeding for the first 6 months of life, and then breastfeeding in combination with the introduction of complementary foods until at least 12 months. Continued breastfeeding can go on for as long as mutually desired by mother and baby. All Trinity hospitals have lactation support too.
So moving on from the actual labor and birth, we wanted to touch a little bit on the postpartum course as well. The immediate postpartum time is right after baby is delivered. There's a special time that we call the golden hour, which is the first hour after the baby's born. If it's a vaginal delivery, it's important to me as an OB provider to do what we need to do to make sure that mom and baby are both safe. But as soon as we get everything cleaned up and kind of get everybody tucked in, we like to give you that special time to just be with you and your baby and the family members that you want to share that experience with, whether that's calling your family members or just enjoying skin to skin with you and your partner and the new baby. However that special experience is for you, we like to call it the golden hour, because it's kind of that very first opportunity that you get to really enjoy and soak in the baby. Another thing that you might be looking forward to is your first meal after you deliver. Whether it's by a vaginal delivery or a C-section, your OB provider will let you know when exactly it's safe for you to eat. But it's not uncommon that we have patients in the hospital call for delivery for their favorite sushi restaurant or their favorite deli sandwich, just things that you might have been craving throughout your whole pregnancy, that something nice you can look forward to have something nice delivered, or send a family member to go pick something up for you. And other things to kind of consider after delivery as well are the pain medications that you'll be given. Oftentimes after a vaginal delivery, you'll be offered Motrin and Tylenol, which are both medications that have been shown to be relatively safe for breastfeeding and, whether or not you're breastfeeding or not, but those are typically our mainstay of medications for a vaginal birth. And then cesarean deliveries are a little bit different. Depending on the type of anesthesia that you received at the time of your surgery, that can kind of dictate which medications that you're given, whether they're IV or oral. But we don't need to bog you down with the details of all of that. But in general, one of our goals for you for your care as a patient postpartum is to make sure that your pain is controlled. And that doesn't necessarily mean zero pain, but just to a comfortable level where we would be, anticipating that it would be a normal portion of your recovery. The reason why ibuprofen is usually the preferred first step is because only a little bit of it actually passes through the breast milk. And then same with acetaminophen, which is Tylenol as well. And both of those medications are available over the counter, but we typically send prescriptions home for our patients on your way home as well, if you desire to do so. Sometimes in a delivery, you may have a tear at the perineum, which is a small portion of the vagina, kind of in between the vagina and the rectum. If you do have a tear here, which is very common, sometimes what we recommend is putting an ice pack or a cold gel pack to that area for 10 to 20 minutes at a time. This is most effective for pain control and reduction in swelling for the first 24 to 72 hours after birth. And the nurses that are taking care of you on labor and delivery are happy to provide you with, as many ice packs as you need to give you some pain control from that aspect as well. Sometimes we also recommend witch hazel pads in that area. And again, for pain control, we recommend Motrin. Sometimes it can be a little bit uncomfortable to sit, but there's special cushions that you can use or even just a pillow. And then we don't necessarily want your whole bottom underwater, but we also sometimes recommend a sitz bath as well, which is where you're kind of just like soaking just the lower part of your bottom in really shallow water. And we have special basins that are made for this purpose. As far as using the bathroom after you deliver, we give you a special water bottle with warm water that you can kind of squeeze and rinse off the area so that wiping isn't so uncomfortable after delivery and after a possible tear. And this could also help trigger you to actually start the flow of urine, which can be helpful too. We do recommend patting dry when you're done. And then as far as kind of avoiding pain to that area when you're breastfeeding, you could try the side lying position, or we call it like the football hold. There's a lot of different positions that we can try to get you off of that uncomfortable area after delivery. And then we also sometimes recommend a numbing spray or a cream to ease some of that pain, as well as a stool softener, which can make it easier for you to have that very first bowel movement after delivery. Whether or not you decide to breastfeed, sometimes you can experience breast pain, likely from engorgement. This is basically where your breasts feel really full, hard, and tender as the breast milk is coming in. This breastfeeding can often help ease the pain and pressure, as well as cold packs. And sometimes, you might have heard of the cabbage leaves. I can speak from personal experience. The cabbage leaves actually work pretty well. But if you're not planning to breastfeed, we recommend bringing a tight-fitting sports bra to the hospital that can prevent the milk production from coming in. And that can help with some of the engorgement symptoms as well. If you are breastfeeding, it's common to have nipple pain as well. This is a normal process of kind of beginning that journey, the breastfeeding journey. And sometimes it takes a couple days or even a couple weeks to get that latch just right. But again, we have our nurses are really seasoned and willing to help. We have lactation specialists at St. Mary's Hospital, and we also have, I personally am a big advocate for breastfeeding support too. So when I come to round on my patients, I usually try and give a special plug if there's any help needed for breastfeeding support. And we try to help you in any way that we can. As far as prevention of some of the complications that can happen after delivery, we do for the most part recommend that you're up walking around as soon as possible. That can help prevent things like blood clots in your legs that could go to your lungs, which sounds really scary, but it's a pretty uncommon complication in our general population. So moving on from that immediate postpartum period, we can also talk about going home and things to expect at, when you're first going home. Some of the medications that we talked about already would be Motrin and Tylenol. If you had a C-section or a significant laceration at the time of delivery in the vagina, we might send you home with some stronger pain medications, and we would counsel you on the special way to take all those medications so you feel comfortable if needed. And then sometimes women also have some chronic medical conditions like thyroid disorders or high blood pressure or diabetes. And so those medications are sometimes continued after delivery as well. And we try really hard to make sure that you have everything you need before you leave the hospital. There's a pharmacy at the hospital at Trinity Health in Livonia where I call it meds to beds, but I'm not sure if that's the formal name for it. But essentially, we have your nurse help coordinate. Once your prescriptions are all signed in into your chart, someone can actually walk over your prescriptions to your room from the pharmacy, which just makes it really easy for you to transition to home. We do want to make sure that you have support and help at home as far as, everything, just transitioning to life at home with a new baby. What we do recommend as far as weightlifting restrictions after delivery is typically nothing heavier than the baby or heavier than a gallon of milk. So it's really helpful to have a support person that can help, with groceries and lifting laundry baskets. As we all know, there will be 1,000 loads of laundry with a brand new baby at home. But kind of gathering your army and figuring out who's going to be at home to help you after delivery and having that all set up ahead of time can take some of the stress of this whole process off as well. And then follow-up, we do typically recommend you seeing your healthcare provider definitely within 6 weeks after you've delivered. But recently there has been, a push just even for a brief visit at the 2-week mark, just to check on your mood, see how you're adjusting. And again, like I said, we take the mood changes in pregnancy and postpartum very seriously. And if you'd like to have a visit in person at 2 weeks, we're more than happy to accommodate that to help check on you. And then, there's some chronic medical conditions like high blood pressure where we might recommend even closer follow-up after delivery, like within the first couple days or even the first week after you deliver as well. So it's hard to think about, your next baby while you're still pregnant. But please plan to review your family planning goals with your healthcare provider at your follow-up visit. Typically, this is done at the 6-week visit. And in the interim, we do advise abstinence, meaning no sex during this time frame. It is possible to get pregnant very soon after having a baby. It's recommended to wait at least 18 months between pregnancies before having another baby. And sometimes the math is hard with pregnancy and postpartum brain. So if you're doing the math in your head, typically what I recommend to my patients is wait until your baby is 9 months old before you try to have another baby, to allow adequate healing of your body before you process another pregnancy. If you are not breastfeeding, ovulation can occur within a few weeks of childbirth. If you are breastfeeding, ovulation may be delayed, but it usually returns by about 6 months. Once ovulation occurs, you can get pregnant again. So that's kind of our window of time that we're looking for when a pregnancy could potentially take place. Ovulation usually occurs 2 weeks before your menstrual period starts. So this means that you can get pregnant before you even have a period. So it's important to be conscious of that. As far as where you can learn more, ACOG is the American College of Obstetricians and Gynecologists. This is kind of our main resource for our care for our patients. But this link here takes you to their webpage that has a bunch of information for patients, not only just for pregnancy and postpartum, but teen health care, menopause care. And it's really just a wealth of knowledge. And I would recommend you kind of click through there to get more information. And then we also have our IHA Cares website, where you can click through and read more information on some of our patient resources there as well. But super important to keep in mind that it's all about the journey, and not just labor and delivery, but the whole process of getting to that point is really special and should be important as well. And we want to support you through as much of this journey as you'd like us to.
Thank you for your time. And at this time, we'll close and hope that you learned about some different ways to feel emotionally supported for your labor and birth. And if anybody has any questions, we'll take questions now.
Okay, there are a few questions in there already. If you have a question, please do type it into the Q&A feature. It'll be at the bottom of your Zoom screen. And we will kick it off with, A question about baths. Can we take hot baths in the second and third trimester? And what about steam rooms?
So hot baths, really, you shouldn't be submersed all the way into a hot bath that's greater than 100 degrees. And the same thing with steam rooms. If you're in there for short periods of time where your heart rate's not increasing, um, really just avoiding it's probably the best option. But if you are planning to be in there just a few minutes, and then, like I said, if you happen to be in a hot tub, you could just stand in there so that your belly's not submersed if it is warmer than that 100 degrees.
Okay, so typically you wouldn't have to worry about a shower because you're not going to get to that temperature.
Right.
Okay. Do you have any suggestions to help prevent tearing? And how long does it typically take to heal if you do end up tearing?
So go ahead. I was just going to say there's a lot of questions surrounding that as far as, are there different exercises that you can do prior to delivery? There's not a lot of evidence that shows that like perineal massage or stretching is helpful to prevent tearing, but it's not anything that's also going to be harmful. So, sometimes we'll talk with women about maybe using olive oil or a little bit of vegetable oil. You can put that on your 2 fingers and kind of go inside along that perineal area. But really there's not a ton of evidence that shows to be helpful for that.
As far as the recovery after a tear and the healing process, oftentimes if we need to put any stitches at the time of the delivery, most of the stitches that the providers that I work with, and I'm sure you guys as well, most of the stitches are actually dissolvable, so they completely dissolve on their own. And nature has actually been kind to women in this way that that area of your body is very forgiving. It's used to being, for lack of a better word, that tissue is used to being traumatized. And so it actually heals very quickly. So if you did have a laceration at the time of your delivery, typically when we see you for your 6-week visit is when we do a pelvic exam to check on the cervix, make sure that everything is healed completely. And at that time, usually the stitches are dissolved and that area is pretty much healed.
Okay. A couple questions on collecting colostrum prior to delivery. Do you guys have thoughts on that or suggestions?
I have had a lot of patients asking about that. Typically, we don't want women pumping before full term just because that can cause contractions, and we really don't want women to have more preterm contractions than they might already have and not realize that they're having. We do have some women that will use like a haka or something that will collect some colostrum, or they'll manually express, especially if they're maybe worried about, breastfeeding. Am I going to, what if I can't breastfeed right away? And they'll want to, give their baby their colostrum. That's totally fine to do. And you can store that in like a syringe. You can get syringes. You can store it in freezer bags and then put it onto a spoon or whatever you would want. And then you can give that to your baby that way.
And then as far as if you're the type of person that did not start producing colostrum on your own at the end of your pregnancy, in general, colostrum will be the first few days after delivery, and then the milk production will actually start day 4 through 7. And when the babies are first born, their stomachs are very, very small. They're about the size of a marble. So as you can imagine, they get full very quickly. So even just a few drops of colostrum is enough to get the baby to feel full. And typically our marker for how we know the baby is getting enough to eat and drink is if the baby's producing a normal amount of wet diapers after delivery. And that's, having poops and things like that. And that's kind of our indicator that the baby is indeed getting enough, even if we don't know exactly how much colostrum they're getting or exactly how much of the formula they're taking or any of those things. So we do get a lot of questions about that. But in general, it takes the body about 4 to 7 days to really have your milk come in, not just colostrum.
Okay. So can you talk a little bit about how long you should not carry anything over a baby weight after delivery? And is it different for a vaginal delivery versus a C-section? Did that make sense? I kind of
Yes.
got that backwards. Okay.
I typically tell patients to wait about 10 to 14 days until they're going to lift anything heavier than the baby. And really, even after that, it's a really gradual increase in how much physical activity you should be doing. I think that oftentimes, we try to do a lot when we're at home, and then we're not used to, okay, I'm going to go home and I'm actually going to take care of my baby and try to take care of myself. And then sometimes, as you start to feel better, you maybe start to do more too soon, too quickly. So I usually say about 2 weeks. I don't know, do you say anything different?
Yeah, I think it depends on whether it's a vaginal delivery or a C-section. With a vaginal birth, I think that gradually increasing your activity is a little bit easier and a little bit shorter timeline for your window of recovery compared to a C-section. And really, it's just because of the healing process. When you have a vaginal delivery, the uterus remains intact versus when you have a surgery to deliver the baby, the uterus is open. So we want to make sure that that scar on the uterus heals all the way before you put extra strain on it, which could come from things like, accidentally lifting something a little bit too heavy. So for my surgical patients, I actually recommend 6 weeks before they lift anything heavier than the baby.
Okay, so here's a question. What if this is not your first baby and you have a toddler at home? That was something I ran into with my second child. So what do you do with that situation?
I was in that situation as well. And I think, in general, what I would try to do is like that first week to 2 weeks after delivery, I would try and get on her level. My daughter was 3 when I came home with my newborn. So I would try and bend down and then kind of hug her and cuddle her. And then you could even sit in a chair and hug and snuggle, but it's best if you tried to avoid lifting from the ground up. And sometimes it's unavoidable if your child is about to run in the street, obviously pick them up and carry them to safety. But, if you have a little one, 18 months or younger, and you need to lift them out of the crib, as much as you can have help or your support person help you with that, that's ideal. But obviously, we do our best and we're good moms at the very least. So
I do think that naturally at the end of pregnancy too, that it becomes more difficult. And so oftentimes toddlers do get a little bit more used to maybe mom not being able to lift them, but I go with the same trick, you can sit and have the baby kind of climb, or not baby, but toddler onto your lap, and then they feel like you're holding them and carrying them. So.
Okay, that's great advice. Okay, so for a VBAC, do you recommend perineal massages and use of primrose oil to avoid tearing?
For a VBAC, I mean, I think the same thing with the perineal massage. There's not a lot of evidence that shows that it's helpful. So I'm not sure if that matters.
I agree.
Know. Yeah.
Okay. And then do you work with your patients like throughout the pregnancy to recommend any YouTube videos or things like that that'll kind of teach them about pushing? Or how do you prepare your moms for pushing and for the actual delivery?
That's a really great question. So what we like to employ at our delivering facility is patient-led pushing. So for first-time moms that have never had a baby before, we're happy to offer you coaching. We do recommend watching some videos and talking to friends and family that have delivered previously and get some helpful tips and tricks from them. As far as not necessarily for pushing, but YouTube videos are great for like pregnancy yoga. There is so much information on YouTube from that standpoint as well. So I would use your resources. But as far as learning how to push, it's going to take practice, especially if it's your first baby. And sometimes it takes a little bit of time to kind of get the hang of it and get into the swing of things. But luckily, you'll have support in the room. Not only your OB provider, but also the nurses are really great. And, there's a lot of tools at our disposal to help, work through that laboring process.
And as you're laboring, you're going to learn so much in the moment, right? I mean, there's only so much preparing for it you can do until
Yes.
you're there, and you'll have the best of the best helping you along. Okay.
And I will say too that, and I'm sure that you've experienced this as well, but some patients, it's their first baby and they're like, oh, I'm just so afraid to push. I'm worried that I'm going to do it wrong. And honestly, we're there to support you, and there's no wrong way to do it. We will coach you through everything if you need that type of support. If you come in and you're like, I want to push on my side, I want to push on my back, I want to squat and push, whatever you're comfortable with, so long as everything is safe with mom and baby, we're happy to accommodate any of your preferences or birth intentions. So
I think too, sometimes women are afraid birthing people are afraid of, pooping when they're pushing. And so, they sometimes, I think, will try to like look for a way to push that won't happen. And oftentimes those are the exact same muscles that women need to be using to push. And so often, just instinctual pushing sometimes occurs, and that is great when it happens, but that doesn't always happen. Like Dr. Wichelmann said, we will coach you. I've been known to say like, hey, all right, try this or try that, trying different things. So
yeah. And sometimes your body surprises you. There's, sometimes first time moms come in and they're like, I'm just so worried I'm going to have to push for 3 hours and end up with a C-section. And several times we're shocked. We're like, wow, this is amazing. You've pushed 3 times and baby's already right here. So I wouldn't sell yourself short on your progress before you get to that point. Sometimes your body can surprise you, even if your uterus has never pushed out a baby before. We've seen crazier things. So.
Hey, can you talk about some of the things that the hospital will provide to birthing moms so that they don't overpack their hospital bags?
yeah. You want me to go with that
Yeah,
one?
sure.
So you actually, I feel like I'm a minimalist, and I feel like you probably don't need to bring in a ton of things because you're going to be going out with much more than what you came in with, including your baby. So, packing something that you're comfortable in, loose clothing that you would wear even while you were pregnant. Oftentimes your weight, you're still going to be very similar weight to when you came into the hospital. But I would say most important is going to be your toiletries, the toothpaste, the toothbrush, the shampoo, the lotions, are the things that you like to use. And then the comfortable clothing, and also pillows. If you have a couple special pillows that you really find helpful, shoes that slide on and off are very helpful. Oftentimes, patients and their family members don't want to walk around barefoot. So I say bring a pair of slides, and then support people to, bringing a hoodie and their own pillow. So
How about a nursing bra? Is that something that women should bring with them, or okay?
I think that's a great idea, especially since, as your milk's coming in, we know that normal bras or bras maybe that have underwire or bras that maybe would be too tight could cause some issues, might cause mastitis. So having a nice soft nursing bra, I think, is a great plan.
Okay. Can you talk about what it means to be induced?
Absolutely. So an induction of labor is essentially a process that can be very involved or not so involved, depending on the clinical situation. And inductions can happen at a variety of times based on what's happening in your pregnancy at that time. In general, an induction of labor is when we are giving you certain medications or we are doing certain interventions to help your body go into labor and delivery. Typically, that process starts with something called cervical ripening, which is where we use certain medications and certain tools and just, whatever we can use to try and help your cervix try and get ready before we start contraction medicine. And that contraction medicine is something called Pitocin. So the different things that we use for cervical ripening could be anything from a medication called misoprostol, which could be given either in your mouth or inside the vagina, kind of at the back of the cervix. And we also use a device called a Foley balloon, which is essentially a small catheter that passes through your cervix, and sterile water is inflated into the balloon to kind of put pressure on the cervix. Usually we tape it down to traction so that that little balloon is kind of putting pressure on the top of the cervix, encouraging it to dilate a little bit more before we start the contraction medicine. Every patient is different. Every induction will be different, and so much of it is dependent on what your body is doing at that time. Some women come in for an induction and they're already 3 centimeters dilated. So that patient is going to be much different than a patient who, might need a bit more cervical ripening if they come in and their cervix is completely closed and firm and posterior and all of those things too. So the process itself can be very variable. But to answer the general question, an induction of labor is when your body isn't naturally going through labor, but we are performing certain interventions to help your body get to that point.
Yep.
Okay.
And
go ahead,
I
Nicole.
think Nicole would add something too.
I was I was just gonna add, sometimes inductions are interesting because, maybe we are doing the cervical ripening part, maybe we start Pitocin, maybe a woman's water is opened, and then the body actually might kick in and pick up on its own. And
Absolutely.
then we take away all of our tools and kind of let the body continue doing what it's doing.
Okay. Are epidurals frowned upon?
No way.
Can you elaborate on that question?
That was the question. I think, I
I
think,
say no.
yeah, I
Yes.
think,
I think it's choice.
Yeah,
right, that's,
again, it's when you're in labor, it's part of your journey. And there's a lot of different tools besides an epidural that we can utilize to help keep pain under control in that labor process, whether that's medications or nitrous oxide gas or breathing techniques or the doula or whatever we can do to support you with pain control. In addition to or in the absence of an epidural, it's completely up to you. And when you say frowned upon, I'm sure there's a lot of things on social media that say that it's not really a natural birth if you have an epidural and all these other things. But I think in general, labor and delivery is a very, very involved process, and everyone has a different tolerance level for pain. And you still get the same prize at the end of the day. You still get your baby at the end of the day, regardless of if you did it with an epidural or without an epidural. And if this person has specific considerations or questions about an epidural, I would encourage you to bring it up to your doctor at your next visit, just so that we can talk more about the risks and the benefits associated with having an epidural and without having an epidural, because there are pros and cons to both situations. And I think that that's important to individualize for your birth intentions.
I think it's important too to remember with like birth intentions and even in the consideration of an epidural, a lot of times women will have goals and, the circumstances maybe leading up to that don't really fit that. And so, I've had patients say, I really want an epidural. And then they come in and maybe for whatever reason they opted not to, and they feel happy with that decision, or they come in and they're saying, I don't want an epidural, I do want an epidural. And then you change your mind, and that's okay because your journey maybe has led to that, and that's part of the path. So I think it's important for people not to be hard on themselves too about those decisions because it's all circumstantial.
Yeah.
sure. And it sounds like it's a great conversation to have before, so you kind of understand what labor can look like with and without, and being able to change positions and things like that, and having kind of the full picture so you can make that decision.
Absolutely.
We're getting into summer, so if we have any moms who are maybe going to be in the third trimester, a swimming pool can feel awfully nice. What are your thoughts on a third trimester? Pools, lakes, are those okay?
Yeah, swimming is great. It's a great way to actually decrease edema. It helps with pelvic discomfort. So I will often tell people if you can get into a pool, float around, I think that's wonderful.
Okay, we have a few more questions. Are you guys okay to stay on a couple more minutes and answer?
Sure. Mhm.
Okay, okay. Is eating or drinking allowed during labor?
I do think it's provider dependent. Nicole and I can tell you what our preferences are for labor. But again, the clinical situation is really dependent. If everything looks perfect and baby's doing well and mom's doing well, I think it's reasonable to say that most providers would let you continue to eat and drink while you're in labor up to a certain point. But again, I think that's an individualized question for labor. But I can tell you what my preferences are. Active labor is when a patient is 6 centimeters. So I typically will let my patients eat and drink up until that point, so long as I'm not worried about an emergency that could potentially be brewing. But that's pretty far and few between. So I typically like to have my patients eat, because if you think about labor in general, it could be several hours, if not a couple days. And so how could I possibly expect you to push your baby out if you have had nothing in your belly for the last 48 hours? So we're advocates for feeding our patients here.
Okay. Can I continue traveling on an airplane in late third trimester?
To that.
Go ahead. Yeah.
So I talk with patients often about travel. And I think the biggest thing in late third trimester, is there's an increased risk of possibly going into labor and then delivering. And so I think it's important for patients to consider, if you're traveling somewhere, are you traveling somewhere that actually can provide you prenatal care if there's an emergency or something that comes up in your travels? And is that a place that you're willing to stay and be at with your baby until you're able to take your baby home? And I think that, it gets harder the later in the trimester, or, later in third trimester. And I think when patients consider that, then they go, oh, yeah, I really don't want to have my baby in the middle of Alaska or wherever at 37 weeks. So.
Okay.
I think in general is if you're looking for a specific time frame of when it's safe to travel, we'll go back to our ACOG guidelines. They recommend no international travel after 32 weeks and no domestic travel on a plane after 36 weeks. Not so much because of risk of like blood clots and things like that, but exactly what Nicole was saying about your potential risk of going into labor and then, potentially delivering with a provider that you didn't have your care with previously.
Okay. It sounds like this person is having bad Charlie horses during the night. Is there anything that they can do throughout the day to help with these?
Yeah. Epsom salt baths at night are going to be helpful. Stretching, some of those heel stretches where you're like pointing your heels up. Oftentimes, if you get a Charlie horse in the middle of the night, one of the best things you can do is kind of, stay onto the bed, but swing your legs off and putting your feet flat. That's going to help kind of relieve that. Some women will start to take magnesium in the pregnancy that actually can help with constipation, headaches, leg cramps. And so if that's coming up for women, we will talk about that and how much to take. Do you have anything else to add to that?
I was just going to add staying really well hydrated, which is really hard to do when you're pregnant. You just kind of like forget to drink water sometimes. And making sure that you stay really well hydrated, especially towards the end of your pregnancy, is so, so important because your uterus is essentially a giant muscle. So when you're dehydrated, just like, if you were to start, if you're running a marathon and you get the leg cramp when you're running, your uterus could start contracting in the same way when you're dehydrated. So those muscle cramps that you're experiencing at night might also be a sign that you're not getting enough water to drink during the day. So that's another area where you could potentially, do some things at home to try and help alleviate that pain for you.
Okay, there's a question clarifying the amount of time to wait before trying for a second child. So you're waiting until your baby is 9 months old, not 18 months old, correct?
Correct. The delivery date would want to be 18 months apart.
Okay, and what are the risks of having a baby sooner than that?
That's a really good question. The risks are different for a vaginal delivery versus a C-section, specifically because of that scar that we talked about previously on the uterus when you have a cesarean delivery. But in general, we want the body to be able to heal completely before it's kind of ready to carry another pregnancy. Some of the risks that we see when we have a short interval pregnancy or a pregnancy that happens within that 18-month window, the placenta can sometimes not attach appropriately, which could lead to things like a small baby. You could also have other complications like preterm birth and delivery. You're at increased risk for gestational diabetes as well, and some other pregnancy complications like high blood pressure later in the pregnancy.
Or dysfunction.
Exactly. Yeah. Thank you. Anything else? Those are kind of the major risks that we try to avoid with a short interval pregnancy. But life happens. And if it's within your family birth plan that you want to have 3 children under 3, I can't say that we can necessarily recommend that you do that, but we're happy to welcome your children whenever they are ready to come into this world.
Okay. A couple questions about pumping. So if somebody is planning to pump and breastfeed, maybe they're even thinking like future returning to work. They've heard that the hospital has a pump that they teach you on. Are we able to bring our own breast pumps to be taught on how to use them? And do you receive some help in how to get that breast pump in the first place?
So We can give you a prescription for a breast pump, and then you will have the option to choose the breast pump of wherever the places that you pick to get your breast pump. And then as far as teaching at the hospital, so at the hospital, I believe they have the Medela pumps. And so if a mom doesn't bring a pump, we do have those there and the parts that go with it. With other pumps, you may find that we might be in the same boat as far as not really knowing how to put those parts together, but we for sure can look things up on YouTube. And I think that's like a great thing too, to kind of do homework on beforehand.
Absolutely.
Like
yeah.
feeling everything, get a feel for like, what does it feel like to connect this tube to this? And then when it turns on, what does it feel like? Just so that it's like working.
But
Yeah,
definitely if you bring the pump into the hospital, the lactation consultants are usually pretty
Yeah.
well versed with all things pumping and breastfeeding. So,
Yeah, that's true.
and like I said, I'm passionate about breastfeeding and pumping. So there are several providers and nurses that have experience personally with using a lot of those products. And I'm sure that we'd be able to find somebody to help you while you're there.
okay. And to your point, planning ahead can be helpful because sometimes you can even register for some of those extra bottles or things like that to get at your shower kind of beforehand. So you feel really prepared when you get home, hopefully. Okay. And if you are not going to breastfeed or if you're struggling to breastfeed, does the hospital provide formula?
Yes, and we actually do provide donor milk for some babies as well
In the hospital.
in the hospital.
Yeah.
Okay.
So yeah, that's
Okay.
what I was just gonna say.
Um, this person is asking, so if you have had emergency C-sections and a vaginal birth, is there a likelihood that they could try for another vaginal birth or should they plan for a C-section again?
I think we should defer those types of questions specifically to your OB provider, just since we don't have enough information to answer that
Okay,
anonymously.
absolutely. Okay. Are there any risks with elective induction after 40 weeks if your cervix has begun dilating? Or
I
do
think
you,
that there's always risk. There's always risk with anything. There's even risk with spontaneous onset of labor. And I think that's, if you're 40 weeks though and you are dilating, I mean, that's going to improve successful chances of if a mom needs an induction. And that's going to be also too very circumstantial and related on all the events that are occurring when that patient presents and comes in.
okay, and if you're getting to that 40-week mark or you're even maybe a little bit over, I mean, your doctor's monitoring you on a pretty much either a daily basis or pretty closely at that point, right? So,
It's usually weekly unless
okay.
there's a different complication, maybe that's causing a patient to be seen more frequently.
Okay. Okay. So if this person says, if we can't hire a doula, but for affordability reasons, will the nurse, midwife, or any of the other providers or people that you might encounter throughout the labor and delivery be able to help with some of the same things, like different positions, movements, breathing, etc.?
Yeah, so all of the nurses at Trinity Livonia, I believe all of them have gone through like a spinning babies workshop. And you are going to get encouragement. If you're seeing the obstetricians, you're going to get encouragement from them. If you're seeing the midwives, you're going to get encouragement from us. There's certain times where maybe I have to have an obstetrician come in the room for something and they might end up helping me and my patient out, or same thing, vice versa. But yes, we will do position changes. We will talk to you about breathing techniques, all of the things that are going to be helpful for you for that labor.
Okay. And this person is saying that they're finding the back to be the most comfortable position to sleep in because their breasts are painful. Is that okay, or should they consider something else?
With sleeping on the back, I think it's important to think about, like, are you totally flat on your back and how far along in the pregnancy are you? So most people actually, I don't know if you can see me, but most people don't sleep flat. You're usually at elevation, and that is okay. One other thing you can do if you really need to be on your back, you can roll up a towel or half towel, put it underneath your hip, so then you're less likely to have that pressure from the baby pressing on those vessels that can sometimes decrease blood flow.
Are there pros and
Okay.
cons to engaging in sex in the third trimester or the late third trimester?
I mean, sex is exercise, so it's a form of exercise, and it can be a form of pleasure. It can also be, some people will say, can sperm help to soften the cervix, or maybe like kind of stir up contractions. So,
Yeah, sometimes it's a great way to try and get your body to go into labor on your own. There are a handful of conditions in pregnancy where we actually don't want you to have sex, like at any point in the pregnancy, and your provider would make that really obvious to you if you were one of those patients where it was high risk for your pregnancy to have intercourse or really have anything in the vagina during your pregnancy. But for the general population, I think having sex is totally fine so long as pregnant mom wants to and is going to find enjoyment or pleasure with that.